Hi, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about cancer in cats. Several types of cancers that I see not uncommonly in cats. Probably the most common would be lymphoma. Generally affects the gastrointestinal tract in cats. I also see fibrosarcomas, and I see squamous cell carcinoma in cats. Those are probably the most common types of cancer I see in my feline patients. Clinical signs of cancer in cats varies a little bit dependent upon what the type of cancer is and the organ system that is being principally affected by that cancer. When I see cancer in the mouth, the most common sign that I will see or hear owners report to me would be changes in eating, right? The cat is either showing reluctance to eat, is having difficulty eating, maybe having a lot of drooling from the mouth. And sometimes in advanced cases, the mouth is so painful that they actually just kind of keep the mouth hung open even at a resting state. For other types of cancer, for fibrosarcomas, oftentimes an owner will notice a very, very hard lump attached to the cat. It can be anywhere on the body, and it generally grows over time. And for lymphoma in cats, since principally it affects the gastrointestinal tract or other abdominal organs, generally the most common clinical signs reported with that type of cancer would be changes in appetite. Generally speaking, it's a progressive loss of appetite or decline in appetite over time, generally also associated with progressive insidious weight loss, sometimes vomiting and or diarrhea, and just general malaise. The cat doesn't feel well, and so oftentimes they're hiding more too. The diagnosis of or diagnosing cancer in cats is generally accomplished through several different diagnostic modalities. We'll always want to run a comprehensive blood panel on that cat. Very often we will also want to take x-rays, radiographs, and then abdominal ultrasound or ultrasound of the chest is also commonly used. And then lastly, I would say that tissue biopsy to basically make a confirmation of what type of cancer we're dealing with. I'd probably also add a PS to this. In the current times we're living in and working in, there are really amazing new diagnostic testing methods, either through blood or urine, where we are able to test or screen rather for a variety of cancers in our canine patients. And while those testing methods or options they're not available to cats currently, but the manufacturers that we currently use and see that do testing in the canine patients, there have been reports that they are working on cat-specific varieties of those testing methods too. So I think that's going to be an exciting tool for us to be able to use in the toolkit to diagnose cancer in our feline patients as we move forward in time. Treatment for cancer in cats is very similar to treatment of cancer in other species, including people. Cancer responds differently to different treatment modalities based upon the cancer that we're dealing with. As a general umbrella, though, you've got chemotherapy, we have radiation therapy, and surgery. Not all of them are going to be successful in any one patient, but that's where the benefit of working with an oncologist would come into play. Once your cat is diagnosed with cancer, your veterinarian is going to give you information about the type of cancer you're dealing with, and in most cases they should be giving you an option for referral for an oncologist for continued consult and treatment options. But if that is not something aligns with what your goals are for the quality of life for your pet, treatment doesn't always have to be pursued. Sometimes palliative care is what many owners will choose. Just basically, I don't want to put my cat through a lot of invasive treatments that would make him or her feel sick just to, have an extended survival time. In those cases, you don't need a referral to an oncologist to have that discussion. We are very happy to have that conversation with you. And there are a number of things that we can give you, tools that we can give to an owner to be able to manage their cat at home and keep them comfortable and having quality of life for as long as possible. So thanks for spending some time with us. I hope you found this little video informative and answer some questions you may have about your pets. If you have any questions, give us a call at Tuscan Ridge Animal Hospital.